Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Lung cancer is subdivided into multiple categories based upon its growth characteristics and what it looks like under the microscope. The two most common of these categories are non-small cell and small cell. Non-small cell is again subdivided into categories based upon its characteristics under the microscope. The two most common of these are adenocarcinoma and squamous cell carcinoma. It used to be that this was where we stopped at this differentiation in order to determine the best treatment options for patients. However, in the last several decades, we have determined that we can go beyond this and look not only at the cell under the microscope, but look within the cell at the genetic material or the genetic program of the cancer cell. Looking at the genetic material of the cancer cell, or the DNA, allows us to identify where in the genetic material or the DNA the mutation or change has occurred that is causing the cancer cell to grow and divide in an uncontrolled way. The reason we care so much about it is because in many instances we have identified individual locations where there have been changes that we can actually target with treatments, and thus called targeted therapies. Within the genetic material, there are chunks of DNA that we call genes, and when these genes are mutated or changed in some way, they can produce signals causing the cancer cells to grow and divide in an uncontrolled way. There are a set of genes that we have now identified that we can target with pill therapies, and ALK is one of those genes that can become altered that we can target with a pill therapy to stop the signal causing cancer cells to grow and divide in an uncontrolled way. Prior to the development of targeted therapies, ALK-positive non-small cell lung cancer was treated very similarly to other undifferentiated types of lung cancer with a 2 or 3 drug combination given through the IV. Alectinib was approved based on the first-line clinical trial called ALEX. This was a trial in which alectinib was compared to the prior standard of care tyrosine kinase inhibitor crizotinib. The response rate for alectinib in this trial was 83%, and this also included responses in the brain. So prior tyrosine kinase inhibitors like crizotinib did not cross into the brain to treat cancer effectively there. And alectinib was one of the first that actually allowed us to be able to target cancer in the brain as well as in the rest of the body. Additionally, one of the impressive benefits of alectinib was the median amount of time that patients were on treatment before the cancer started to grow again, which in the case of alectinib was an impressive 34.8 months. Given these impressive results compared to crizotinib, alectinib is now considered the standard first-line treatment for ALK-positive non-small cell lung cancer.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, Takeda, AstraZeneca, and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.